Get confused about coronavirus is easy, and due to the amount of information on the internet, people can overreact or no reaction at all. To avoid that, in this video we will bring some important information and answer the most common questions to put this disease outbreak in perspective. You will know more about how the coronavirus was created, why is it dangerous, what are the most common symptoms, why is plenty of people dying, what can we do to avoid being infected and infect others. Viruses are not the same as bacteria. Viruses are smaller than bacteria and can't survive without a living host. Because of the nature of the virus, it attaches itself to living cells or tissue and usually reprograms them to reproduce itself due to their parasitic nature. Also, unlike bacteria, most viruses do cause diseases like cold, AIDS, herpes, and chickenpox. Coronaviruses are a big family of different viruses. Coronaviruses were described that caused disease in multiple animal species, including rats, mice, chickens, turkeys, calves, dogs, cats, rabbits, and pigs. Coronaviruses are a large family of zoonotic viruses that cause illness ranging from the common cold to severe respiratory diseases. Zoonotic means these viruses are able to be transmitted from animals to humans. Some wet markets sell wild species like bats, badgers, wolf pups, snakes, bamboo rats, porcupines, wild boars, and raccoon dogs. Crowded conditions can let viruses from different animals swap genes. Sometimes the virus changes so much it can start to infect and spread among people. That's what is suggested about what happened with the most recent coronavirus that makes the jump to human infection. COVID-19. Coronavirus is not something new in humans. SARS emerged in 2002-2003 as a coronavirus from southern China and spread throughout the world. Also, MERS started in Saudi Arabia in 2012. And nearly 2,500 cases have been in people who live in or travel to the Middle East. COVID-19 outbreak was first documented in Wuhan, Hubei Province, China in December 2019. Wuhan Municipal Health Commission, China, reported a cluster of cases of pneumonia of 42 patients in Wuhan, Hubei Province. It is important to know that for the same time in China the people were preparing to celebrate the most important official public holiday, Chinese New Year, which is also the time for families to be together. This means that millions of people traveled around the world to see their families. This is for many people one of the reasons why this virus spread so quickly. This virus can be transmitted from person to person in many of the same ways, including coming into close contact with a person who has a viral infection, contact with the body fluids of a person with a viral infection, transmission from mother to child during pregnancy or birth, coming into contact with contaminated surfaces. These viruses are associated with both upper and lower respiratory tract disease and are likely common human pathogens. The incubation period means the time between catching the virus and beginning to have symptoms. For COVID-19, this incubation period has a range from 1 to 14 days, most commonly around 5 days. COVID-19 virus commonly causes or symptoms in most of the cases are shortness of breath, fever, dry cough, loss of sense of smell. At this time we all know that this virus is taking the lives of thousands of people around the world. For some experts, the possibility to have this virus in the future could be up to 50%. The real problem could be when all the people get sick at the same time, and the capacity to take appropriate care for the most affected patient will decrease drastically and the chance of dying is going to be even higher. Also, this affects the capacity to help other people with different but severe health problems, causing a serious public health problem. New England Journal of Medicine shows that the virus lives 3 hours in the environment, 4 hours in copper, 24 hours in cardboard, 2 days in stainless steel, and 3 days in plastic. The best way to prevent illness is to avoid being exposed to this virus, and the best weapon we have now against the virus is to stay home. General precautionary: if you go out, wash your hands, leaving shoes at the entrance of your house when you arrive, washing the clothes you used to go out, avoid touching all the food that you are not going to buy in the supermarket, and try to select the products that are less exposed to being contaminated. Usually those are on the back of the shelf. Until the vaccine is available for all the people around the world, we will need to help each other. Our body itself is a miracle and we have to protect it, our immune system. It's being affected for many things that we did not notice before. Eating food that is bad for your health, excessive craving of sugar, sedentarism, stress, smoking. Those are the most common activities that shut down your immune system and stop the healing process of your body. Now you know. Eat better. The recommendation is to eat 50% green, 25% protein, and 25% carbohydrate. Physical activities. Eat low sugar, don't smoke, focus on positive emotions. Don't be afraid of this pandemic, this will pass, and for now, be safe and take it seriously, taking care of yourself and your loved ones. In the description of this video, I will leave you some links that could help you to improve your health. If you like this video, press like and subscribe to receive more informative videos.